Good nutrition is actually vital for the children, nourishing both the body and the soul. But for the ones affected by congenital diaphragmatic hernia, families faces also a big problem because these children too faces a lot of feeding hurdles. Hello everyone, this is Jyoti Pachisia here, consultant dietitian and faculty from Kolkata. Because of the early illnesses and the surgeries, babies with this type of hernia often requires a feeding tube for months, and this delay can actually make it harder for the child to learn how to suck, how to swallow, and even breathe at the same time. Many even faces several problems like gastric distress, can be vomiting, or can be even retching as well. So while even others also may even develop allergies or the sensitivities also. So in a way, what is happening, they start rejecting many textures, even the new textures also, and even refuse to food altogether. So this way, what is happening, they can't actually take up the food properly, and that's where the malnourishment begins, because they even can't forget the uncomfortable, the medical experiences they faced during the hospital. But guess what? There are some basic steps which, as a parents, you can actually follow to make sure that this hurdle can be resolved a bit. Number one, patience is the key. You know, as a parent, we actually lose out our patience very easily. कि my baby is not eating properly, वो ठीक से खाना नहीं खा रहा है, उसको मैं chew करने बोल रही हूँ, तो the person is not, my child is not eating actually. So you have to be a bit patient about it. If the child is not eating now, maybe you can introduce a little later. If that repeats, then it's better to skip that food and start introducing another one. Let it, this process goes on. And then finally, when the child accepts with wholeheartedly, that's where the patient's result comes up. Second, you can actually, these days we get available of around, oral friendly, safer, durable toys which actually being actually given to the child to introduce and rather to improve their oral motor skills as well. The third thing is gradually introduce the textures. ऐसा नहीं है कि आज किया तो कल फिर दूसरा texture. No, this is not done. So when you are introducing the texture, new texture, use the 3-day rule. आज किया, next day किया, फिर again next day, and then 4th day or maybe 5th day, you can start introducing the another texture. This way, the child will be used to with this one. And the fourth one, which is the most important yet the most neglected one, is the tracking the food and monitor. As a parent, हम तब समझ नहीं पाते हैं कि this is like अभी तो खाया, अभी क्या प्रॉब्लम हुआ होगा, मे बी लेटर और समथिंग बाद में समझ में आएगा. No, this cannot be taken or this cannot be entertained in fact. As a parent, you have to make sure that you are entering or giving rather every food intake you are giving to the child, that has to be done entry, and that has to be entered into the diary to make sure that even if a child develops any problem, this can be resolved. Say suppose suddenly after having a porridge, maybe suji porridge, child has started saying ki maybe it's cramping or it's like cranking types, kuch ek to problem kar raha hai. So maybe you can stop introducing suji for the time being. So like this way, there are some basic steps which can actually reduce the feeding hurdles in children with congenital diaphragmatic hernia. Happy nutrition, happy learning. Thank you.